To mask or not to mask? Dr. Michael Gaeta, I'd like to explore this question with you in some detail because it's really become a major concern in public health and also in our society today. So for myself, if you're not familiar with me, I'm a doctor of acupuncture and oil medicine, dietitian, nutritionist, and I've been practicing Chinese and functional medicine for 30 years. So I wanted to look at this question of to mask or not to mask and look at some of the science around this question. And what's become super clear is that there is no scientific evidence to support the use of the mask. It's based on assumptions. It's based on basically propaganda is what it amounts to. And we're making this sweeping public health requirement for massive parts of the country and the world without any actual basis in science, evidence, or data. And so this is something that the health departments they specialize in making recommendations that ignore current available science. This is a great example of that. So this is the standard propaganda that using a mask or a bandana, a scarf, just a thin piece of cotton somehow is going to protect you and others from coronavirus exposure or infection, despite an absolute absence of evidence to support this recommendation. The Surgeon General even admitted and acknowledged and told the truth that they are not effective. And he said this back in February, seriously, people, stop buying masks. They are not effective in preventing the general public from catching coronaviruses. But if healthcare providers can't get them to care for sick patients, it puts them and our communities at risk. So what he's pointing out there, as a physician, he's acknowledging that masking healthy, asymptomatic people has absolutely no benefit, which is true. And as we'll see, it actually does more harm than good. And that's a major problem. And the Vice President pointed out that the average American does not need to go out and buy a mask to protect themselves from coronavirus. And that's absolutely true. And so despite an utter lack of science evidence or data, this has become the norm, standard, and requirement for so many places in the US. Let's look at some of the research. This came out of the Center for Infectious Disease Research and Policy at the University of Minnesota. And what did they do? They looked at the science. They looked at the evidence. They looked at the data, something that the health departments and governors and mayors absolutely refuse to do. So these scientists actually bothered to look at the evidence. And what did they conclude? The data is lacking to recommend broad mask use. We do not recommend requiring the general public who do not have symptoms of COVID-19-like illness, because COVID-19 doesn't have a lot of unique symptoms, cough, fever, shortness of breath, could be a lot of things. They do not recommend this to routinely wear cloth or surgical masks. Why? Number one, there is no scientific evidence that they are effective in reducing the risk of SARS-CoV-2 transmission, which is absolutely true. There is no evidence to support this recommendation. And he echoed the authors, these two doctors, Dr. Brousseau and Setsima has acknowledged this, that we need to preserve the supply of surgical masks for at-risk healthcare workers. Why would they say this? So wearing a mask is standard procedure in an operating room or working with people who are sick, or possibly even for the person who is sick. So masking healthcare workers and possibly masking those who have active disease is a long established practice. But to mask asymptomatic healthy people, this has never been done before. Just like quarantine. Quarantine has been used for millennia to separate out folks who are sick from the healthy population. And you know what? That works and that makes sense. This quarantining healthy people and forcing them to be separate from each other and this whole lockdown thing is a new and failed experiment with no science or evidence or data to support it as a safe and effective, proven public health intervention. So we're doing this like massive, turns out to be failed experiment of quarantine lockdown, and are recommending a public health intervention of masking that is not supported by science at all. And it gets worse. If we look, this is published in British Medical Journal, one of their journals, and this was an open source publication several years ago, Infectious Diseases Research. And this was a very significant study that was done, and I'll put it up for you here so you can look at it. This is a very significant study that looked at the effectiveness of masks. And let's see what they found. And this was, again, published years ago, but it was, this information has been completely ignored. And they looked at 1,600 healthcare workers in hospitals. And they had three groups. They had medical masks, sometimes called surgical masks. They had regular cloth masks, which is what 90-something% of the US population is using now, or a control group. And they looked at the data and they analyzed this over several weeks. And they looked, this is a multi-center study looking at 14 hospitals. And what did they find? The rates of all infection outcomes, quote, were highest in the cloth mask arm. Actually, it was 13 times higher risk of all infection if you wore a cloth mask. I want to repeat that. Compared to the medical surgical masks, the cloth mask, which almost everybody is using these days, a bandana or some basic cloth mask, increased the risk of infection 1,300%, which is astounding. They also had 664% increase in flu-like illness wearing the mask. So clearly, and on top of that, they also had higher rates of laboratory confirmed viral infection, 172% greater evidence of laboratory confirmed virus when you wore a cloth mask. And the penetration by particles was 97%. Medical masks, 44%. This was the first randomized controlled trial evaluating the effectiveness of cloth masks. And what did they find? It was a disaster. Cloth masks do far more harm than good. There's no evidence to support their use, and we have strong evidence that they actually make things much, much, much worse. Now, the authors in this study theorized as to what the mechanisms of action were, like why. We know the cloth masks are a complete disaster, completely ineffective, they make things much worse. But why? So they theorized it might be moisture retention, trapping moisture in the mask from exhalation, making it a net to catch pathogens. Reuse. People use them over and over again. They'll stick their bandana on to go outside or go in the store, and they're reusing the same mask. People routinely are not changing masks every time or washing them between use. And poor filtration, you're not filtering anything. The coronavirus has the virus size is a couple of microns. And you could drive a truck by comparison through one of these cloth masks, and that you have an clear risk of increased infection. So you're doing much more harm than good. This is absolute solid evidence, a randomized controlled trial with 1,600 medical workers in these hospitals. This is a retired neurosurgeon talking about this as well, about hypoxia. Since you can't breathe well, the thing that you die without is oxygen. And a decreased oxygenation of the body is a massive impediment to not just energy, but also immune function. Dr. Blaylock, neurosurgeon, talking about this. By wearing a mask, the exhaled viruses will not be able to escape through that wet membrane of the moist mask and will concentrate in the nasal passages and possibly affect the brain, which is his concern as a neurosurgeon. And so he looked at 2 studies that he reported on in this article. A third of the masked healthcare workers developed headaches. Almost 2/3 of them required pain medications, which are catastrophic. Non-steroidal anti-inflammatories, for example, do enormous harm to the liver and kidneys, liver failure, kidney failure, leaky gut, intestinal bleeding from many of these non-steroidal anti-inflammatories. And the N95 mask, which is considered like, the one you need to use, reduced blood oxygen saturation up to 20%. That's catastrophic for the person's health and well-being and their immune function. So you're making it more likely they're going to get sick from anything by wearing a mask. In the second study, he quoted 81% of these healthcare workers developed headaches. So these are hypoxic headaches, impaired oxygenation, which definitely we know from the science impairs immune function and also viral resistance and increases the risk of infection. The mask can possibly trap an exhaled virus, causing reinfection. It's a complete disaster. And so I really call on all of the public health authorities, officials, mayors, governors, everybody to stop this detrimental practice. You're doing more harm than good. You're injuring people much more than the virus would. The virus has maybe a 0.1% fatality risk. It's about the same as the seasonal flu or a severe seasonal flu in terms of mortality, and we're taking these extreme measures with no evidence, science, or data to support it. Let's look at, this is published in The Independent. This was a medical chief in England. This is Dr. Jenny Harries, Deputy Chief Medical Officer in England, said the mask could actually trap the virus. Quote, for the average member of the public walking down the street, it is not a good idea. Not a good idea. This is one of the most senior physicians, public health physicians in England. It is not a good idea to wear a face mask in the hope of preventing infection, which is absolutely true. And yet the governors and mayors just plod forward blindly without actually looking at, is this a good idea? Is this actually based in science? It is not. This was published, and this is from a dental journal, Oral Health. And these folks, dentists and dental assistants and dental hygienists are in people's face for hours every day. And they looked at, this is published recently, a few years ago, the primary reason for mandating the wearing of face masks to protect dental personnel from airborne pathogens. That makes sense, but does it work? This review, this was a literature review, a study of studies, systematic review, and meta-analysis, found that face masks are incapable of providing such a level of protection. This is the evidence, and this is from a human rights attorney. The non-surgical masks do not seal or keep germs in or out. The mesh is not the right size to keep microbes in or out. So people are mouth breathing, they're not getting enough oxygen. It's a complete disaster. So we must immediately end masking for healthy asymptomatic people. We definitely can make a case for masking medical personnel who are working with sick patients, and possibly even the folks who are sick. But to mask healthy asymptomatic people does much more harm than good, and it needs to stop right now. So here's a CNN correspondent giving the president a hard time for not wearing a mask, and within minutes after the press conference ends, this White House correspondent, Caitlin Collins, just pulled off her mask and was mingling in close proximity to other reporters and other people in the White House. She was like right up to them with no mask on. She took it off immediately after the end of the press conference and was kind of caught as being a massive hypocrite in this event. So this presentation is an excerpt from a free weekly immune webinar that I've been doing for several weeks, Natural Immune Support for Today's World, Natural Immune Support and Prevention, Perspectives on the Pandemic. And we do this every Monday until we stop from 11 a.m. Mountain Time. And just go to my website, michaelgaeta.com/immune. And the main website is just michaelgaeta.com. Lots more health information there as well, and practitioner trainings at that location. So thank you for this listening today. Please take action. Please share this with your local health department, the mayor, the governor, anybody who is continuing this disastrous policy that does far more harm than good. We've got to take action and end this ridiculous, baseless, unscientific masking policy. So thanks for listening, and I hope you and yours are well. Take care.